On the screen. All right, thank you everyone for watching. Floris van der Breggen here from SyncVR Medical in this room together with Patrick Sardo and Bassam Redwan, both thoracic surgeons. And we're going to talk with you about what virtual reality can do within thoracic surgery. First of all, so myself, Floris van der Breggen, founder of SyncVR Medical. And for those of you who are not that familiar yet with what virtual reality is and what that can do, bear with me, because here I will show you a little bit of an example how virtual reality looks like when using virtual reality within healthcare. And in this realm, even within the thoracic surgery. What you will see here is, well, for example, this patient using virtual reality during surgery for becoming so relaxed that the patient, while being awake, needs less medication and is so relaxed that the surgery goes in a better way than it would normally go. This is one of the many use cases of virtual reality, and we will talk about this with Patrick Sardo and Bassam Redwan for now. To introduce yourself as well, Patrick and Bassam, starting with you, Dr. Sardo.
Hi, Floris. Hi, guys. My name is Patrick Sardo, and I'm a medical doctor at Hanover Medical School, currently head of thoracic surgery, and one of my specialties is awake lung surgery. Basically, you can perform even complex procedures on the lung of patients while they're fully awake, and that's also one of the main points that rose our interest, and that's the main point why we first got involved with you, Floris.
Yeah, thanks. What about you, Dr. Redwan?
Yeah, my name is Bassam Redwan. I'm also a thoracic surgeon at Germany, and I have known Patrick also for a few years. Patrick is one of the pioneers regarding the minimally invasive surgery in Germany, and he actually adapted the virtual reality technique in Germany as one of the first doctors performing that. And right now, we are actually working on a very nice protocol to implement this very nice technology in the whole perioperative setting of thoracic surgery. So what we have actually now implemented is the use of the virtual reality during awake surgery, which is actually, as Patrick always says, it's actually an old concept operating on patients in the awake condition, but implementing and establishing the virtual reality would lead to a much relaxed situation for the patients, and rather let us surgeons have better conditions to perform the surgery in these carefully selected patients, of course.
Nice, thanks. Dr. Sardo, question for you. What are the main use cases of virtual reality in thoracic surgery? Can you explain that to the viewer? And do you maybe even have an example of how virtual reality has benefited patients or you in your experience?
Well, that's an interesting question, Floris, because first off, you would think that virtual reality in thoracic surgery, is it any good? What could be the use cases for implementing this kind of technology in the first place? But in the end, as a surgeon, you take care of the entire journey of the patient through the healthcare system, like the system in Germany. And you have to take care of the preoperative setting, the surgery, and the postoperative care. And in the preoperative setting, you want patients to be as healthy as they can potentially be, as healthy as possible. And patients that are marginal, we see patients aged 80 and over with a lot of comorbidity, and patients that I myself wouldn't have performed surgery on as much as 10 years ago. And that's the first thing we would like to do, to try to do some sort of prehabilitation to take care of the patient even before he undergoes surgery. And virtual reality can be very helpful in that. You showed us different physical exercises that can be conducted by virtual reality guidance. And that was the first thing that piqued my interest. And then the next thing I wanted to try out was to implement this technology during the procedure. And not for myself or for the surgeon, for the surgical team, but for the patient, because the patient goes to the OR, is anxious, doesn't know what will happen to him. And to perform the kind of procedures we do nowadays on an awake patient is very, very challenging. It's challenging for us, but it's very challenging for a patient as well, because he's awake and he's aware of everything that's happening in the OR. So my first idea was to utilize this device you developed to try to shield the patient from everything that happens around, and that he doesn't realizes fully the situation he's in by presenting him with distracting exercises. And so the first aspect was to try to shield the patient from outward influences. And the next thing we are toying around with right now is to even improve our surgical conditions by trying to modulate the respiratory frequency of the patient during the procedure. Because if you have a patient that breathes very with a high frequency, inhales, exhales very fastly, the procedure we are trying to do becomes much, much more difficult. So try to condition the patient and try to manipulate his breathing frequency by presenting him with exercises in a certain frequency. So that was the next idea we had. And that's something that's that looks, at least to my according to my personal opinion, very, very interesting, very promising. And the last part, the postoperative care, is very important for the patient as well, because one of the major issues after lung injury, after lung surgery, is pneumonia. Basically, a patient gets a respiratory infection due to pain, and that's one of the main reasons that even if the surgery itself went very well, the patient might be impaired permanently afterwards. So we're trying to avoid, of course, the patient developing pneumonia in the first place. And one of the most important things is to take care of the postoperative pain by utilizing different drugs. But all of these drugs have side effects that we are trying to avoid. And for already work in cooperation with our head of pain service over here at the head of a university, and wanted to improve pain therapy and pain avoidance after the procedure by utilizing the VR device. So we have a multitude of potential use cases for a VR device, and I'm totally convinced that there will be several more interesting ideas you can develop once you understand the technology and once you've been toying around with it for a bit. But as usual, you have those three aspects. You have the pre-surgical, the intra-procedural, and post-operative course. And those are the three phases we as surgeons are directly involved with. And those are the different timeframes in which we can try to improve the delivery of healthcare. And that's where we can utilize your device to improve the delivery of healthcare.
Thanks. Very, very good explanation, I think. Pre-operatively, intraoperatively, and post-operatively, using virtual reality for patient care. Dr. Redwan, do you have maybe also an insight about, well, of course, these are opportunities to use virtual reality in around thoracic surgery. What are now you see the main challenges around implementing or studying this?
Well, I mean, the main challenge regarding any new technique is always the acceptance of the medical staff, of the patients, to this technology, I guess. Of course, as Dr. Tado always mentioned, we need to understand the technique more. So we are trying, for example, to also implement a pain measurement tool during surgery to just quantify the pain of the patient during surgery, and to actually see if implementing and utilizing the VR technology would actually lead to a measurable pain reduction during surgery. So I guess as soon as we really scientifically and clinically have the evidence that the VR technology is not only by guessing or by assuming that it reduces the pain. No, it really does reduce the pain in a measurable manner. Then the acceptance upon the medical staff staff will be higher. And I guess this is, in my opinion, one of the main or major challenges while implementing this new technology. But so far with this technique, we had a really nice resonance from medical staff and from patients. What Dr. Sada also has mentioned, these awake procedures are actually now, you might really differentiate between the patient collective. So mainly we perform that, as Dr. Sada has mentioned, in the more ill patients who would not really be able to have anesthesia performed without a lot of risks. I mean, at the end of the day, you can perform anesthesia almost always, but the risk would be higher in such patients. So such patients would be our first option to implement such technology, rather, and to render the surgery, to make it really also acceptable and also better. But in the next step, I guess we may want to implement this technique in really healthy, fit patients, in not really ill patients, while performing a variety of thoracic surgical procedures, because we all know that mechanical ventilation during surgery, it is always unphysiological. It is always actually not the thing we really have to perform. And when we can avoid such ventilation using good technologies, I guess that would be a really good step towards improving our medical care. And as we all surgeons know, there is this early recovery after surgery protocol, and I guess the VR technology would be one of the main cornerstones for the next years while implementing such protocols in thoracic surgery.
Yeah, thanks for that. I think indeed a very good point that you outlined regarding building up evidence to actually get acceptance from staff, as well as, of course, working with the team from the acute pain service to the nurses working on the surgery department to actually make sure that they are completely able and comfortable to work with it. And that is not always easy when it comes to implementing something new. A very good point that you make there. Then last short question to both of you, starting with you, Dr. Zardo. What do you think the future of virtual reality in thoracic surgery holds? What do you see virtual reality doing in 1 year, 5 years, 10 years, maybe even? What is your forecast?
It's a very good question, because nobody of us can say what will happen in the next few years, because basically right now what we're seeing every day has been science fiction just as short as 5 to 10 years ago. We're doing the kind of stuff that I personally didn't feel possible to happen during my lifetime. So it's very interesting times we're living in right now. But I believe that we will have not just several use cases for virtual reality, but we'll have use cases for different blends of reality. Virtual reality, augmented reality. I guess that next to a virtual setting for directly interacting with the patient can be supported by augmented reality systems that will help us to access medical knowledge and directly implement it during our procedures to get help at certain points during a procedure. If you're doing kind of surgery you don't do it that often, by utilizing virtual or augmented reality, you might get help in delivering those procedures. Virtual reality will be very helpful in training young physicians, because medical education, especially surgical training, is a major issue right now. We have problems recruiting the next generation of surgeons because our working conditions are getting worse by the day, and you need to develop new ideas to train the surgeons of the future. And if you can motivate young persons to become surgeons, you can do it by utilizing modern technology and giving them the opportunity to do certain things they would be able to do only after years of experience by shortening the formation time utilizing these kind of devices. So I guess there's a multitude of things you could do in the next few years with the technology that's already available today. And I guess also that it's not just something that's confined to our field of surgery, to lung surgery, but more so to surgery in general, because we're trying to get less invasive in every single surgical field. And you can do hernia surgery, you can do vascular surgery, be it on the carotid artery, on the femoral arteries, stent implantation, you do cardiac valve implantations by percutaneous techniques, and all those procedures you do under regional anesthesia can be helped by a virtual reality device. So there's a multitude of things to discover and to toy with. And personally, I believe that you don't just have something that potentially works very well by helping during prehabilitation, during pain modulation, during the procedure, and even afterwards. So it's not just that you have the potential benefit of your device, but there's no known side effect to what we're doing right now, because you basically just put on a pair of goggles and then go with it. So you do something that's potentially very beneficial for a patient with very few potential drawbacks. So that's basically the dream we're all thinking of, by doing things that aren't harmful but potentially very helpful. So
yeah, exactly. And if that can then force a change of the traditional methods that are, well, in some cases now being used in the wrong way, medicative methods, that of course is that will benefit people for the better. And then the medical training is definitely something that is a very interesting topic as well that we're getting into. Dr. Retton, what about you? What are your thoughts about this?
Well, I guess Dr. Tado mentioned a really important point about the medical training, which would be also even getting easier by applying such techniques. And in my opinion, or my own dream would be that the VR technology would really be a main part of the surgical management of the patient. So as for thoracic surgery, for example, would be my imagination that as soon as the patient gets admitted to the hospital, he gets familiar with this technique. And for us thoracic surgeons is the point of avoiding complications such as pneumonia by performing physiotherapy, for example, is a really main point to get a better outcome for our patients. So I guess also the time of the corona pandemic, together with the fact that we always get less people working in the health sector, would make every technique facilitating such physiotherapy, for example, really, really tempting. And as I know, Flores, you have, and we also have tried the goggles where you actually perform also exercise. We also may perform also some breathing exercises. So it would be great if the patient gets admitted to the hospital. We perform all the stuff we need to finish by blood workout and everything else, and then the patient gets used to the new technique, to the VR technique, and he actually tries that. And in the best case, most or a lot of patients will be actually operated on in the awake condition. But even if not, we have the patient post-operatively directly after the operation, where he also gets the goggles in order to have the pain management and reduce the morphine and the use of other drugs, which actually make the patients more sleepy rather than awake and exercising. So I guess the VR technique, or the whole VR sector, has a lot of potential to be implemented in the whole medical story, in the whole medical day, actually. And beside the point of the education, I guess it's a really nice tool where you can basically use overall in the medicine. It's not only for surgery, of course.
Yeah. Also a good point that you make there. And then, well, from use cases for the patient perioperatively, but also for the surgeon for surgical training and maybe pre-operative planning. Those are the possibilities in that sense are limitless. Now, of course, together we've have quite a strong focus on the patient trajectory. Studies will start regarding that also. Very interesting. Hey, we're closing this session off. Is there anything that you would like to still close off with for anyone in the thoracic surgery or interested in this topic? Any of you?
No, I would just recommend everybody to give it a try. You have to see it to believe it. And luckily, even in Germany, there's been a turning point a couple of years ago, and young guys that are motivated, highly skilled, like Bassam, are interested in pushing the envelope and trying to find new fields and to be a bit more visionary and not as cautious as the older guys in our field. And there's certainly room for improving the day-to-day business we are doing, and virtual reality might be key to it. So guys, get in touch with Flores and try out the device. You need to see it to believe it.
You get an excellent service, I tell you that.
Well, thanks a lot, Dr. Sardo and Dr. Redwan. I think a lot of interesting insights have been shared here. We're closing off this. Thank you all for watching this. For any questions, obviously get in touch with SyncVR Medical, or get in touch with either of the two gentlemen in this session. Well, looking forward to meeting you.